just received an order to give a sub-Q injection of U100 Humulin R. I'm going to be doing that based on, or with the 6 rights in mind. So that is right patient, right dose, right route, right date, right time, and right documentation. So the first thing I'm going to do is I'm going to go ahead and check my MAR and see that room 115, Bob Johnson, has an order in there from Dr. B for 10 units of U100 Humulin R in there. So I see that that is in there. I see that it has not been given, so it is time to give it correctly right now. So the next thing I'm going to do is I'm going to go ahead and withdraw my medication from the dispenser. This is a multi-dose vial, and I see that it has been opened. The expiration date is 4/27, so it is within the time. The date, she opened it today. It is Humulin U100 R. Sorry. And then there is no particulates or broken glass. It does have the date as today was opened and the initials of the last nurse that gave it. So everything looks good with that vial. The next thing I'm going to do is I'm going to go ahead and clean the top of the vial with the alcohol pad. Okay. And while that is drying, I'm going to go ahead and prepare my needle. And the inside of this is going to be my sterile field. I'm going to go ahead and take that cap off. I'm going to draw up 10 units of air into the vial, or into the syringe. Go ahead and insert that into the rubber stopper. Insert the air into the vial, and then I'm going to go ahead and draw out 10 units. I'm going to go ahead and flip that to get the air bubble out. Okay, I'm going to go ahead and remove that from the vial. And then with the swoop, or the scoop technique, I'm going to go ahead and put that up and secure it. The next thing I'm going to do is I'm going to go ahead and have another nurse verify that I did administer it correctly. So, 10 units.
10 units, and
then here is the Humulin R U100 dose vial.
Oh, okay.
Expiration date with the initials on there.
Oh, okay, cool.
Perfect.
Did you check it on the Mars?
I did.
Okay,
I
cool.
didn't check that on the MAR.
Oh, okay, not Mars.
Right. Okay, so now that I have my draw complete, I'm going to go ahead and get my supplies, and I'm going to go into my patient's room. Hi, Bob. How are you doing today?
Okay.
So, my name is Ashley. I'm your nurse today. I have an order from Dr. B to administer 10 units of U100 Humulin R insulin. And you remember what that's for?
For the diabetes?
Yep, we're trying to keep those sugars down. So that's what we're going to do today. Bob, can you go ahead and give me your name and date of birth?
Bob Janssen, January 30th, 1945.
Okay, so you pronounce it Janssen.
Yeah.
Okay,
yeah.
Perfect. So I'm going to go ahead and check that on the MAR. Dr. B, Bobby Janssen, correct. And his date of birth is on there correctly. Bob, do you have any allergies?
No.
Okay, and I don't show any on the MAR as well. And again, I show the 10 units of the Humulin R U100. So that is correct. The next thing I'm going to go ahead and do is wash my hands. Dry my hands. And then I'm going to go ahead and apply gloves. Bob, I'm going to have you just lift your shirt there for me.
Okay.
All right. I'm going to take my alcohol pad. And I'm going to go ahead and clean the site from inside out, circular. Okay, dispose of that pad. And while that is drying, I'll get my needle ready. So because Bob is a little bit overweight, we're going to go ahead and administer the insulin at a 90-degree angle instead of a 45-degree angle. Okay, so I'm going to go ahead and get rid of that cap there. I'm going to go ahead and pinch Bob's skin up a little bit, which I'm going to move Bob this way a little bit. So I'm going to pinch that little fat roll on the left side of his abdomen here. And then I'm going to go ahead and administer it at 90 degrees. And then we're going to go ahead and push that syringe and inject that over 5 seconds. Perfect. We're gonna go ahead and pull that out slowly. I'm gonna dispose of my needle in the sharps container. And then if Bob was bleeding, I would go ahead and take some gauze and dab that. But he's not, and everything looked good. Bob, how do you feel?
Okay.
Okay. And that went okay for you?
Yeah.
All right. So then the final thing that I'm going to do is I'm going to go ahead and go to my MAR and document the patient's response. I'm going to document that we inserted that insulin in the left lower abdomen and that we administered 10 units of U100 Humulin R.